Uh, and all the time when I'm giving lecture about hypertension, I'm saying I don't know what is hypertension. But Dr. Abdullah Shahab, when he put for me this hypertension is a hemodynamic disorder, I find this is what I was looking since long time. Because actually, we don't know exactly what is hypertension. It is number, it is disease, it is risk. There is no data to support what is hypertension. To understand this, what is hypertension? If you look to the patient from this perspective that you are measuring the number, I think you are doing the most, what you said, foolish things in your practice. Why? Because look to this picture. It is something very unusual, but we said all the time, don't always believe what you see. Why? Because this is the chair. The same like when we are looking for the blood pressure. What it is, if you look to the guideline all the last 20 years, we'll find the number of hypertension have been changed dramatically. Every 3-4 years, they said up, down, 160, 140, 130, 120. So even the guideline, they didn't know exactly what is the number for hypertension we should treat. And finally, you find this is what you call tale of two guidelines, the American and the European. Everybody's saying different number for what is the level you want to reach with your patient. So this is tell us what is hypertension. For sure, it is not number. Number two is number, it is not number. What it is, this is the hemodynamic of the blood pressure. This is the hypertension. The hypertension is not number. The hypertension is the one behind this wall. This is the hypertension. It is a hemodynamic disorder. It is not a number. So please remember this. Although historically defined as an elevated blood pressure alone, which is not true. Hypertension is characterized by abnormalities of the cardiac output, systemic vascular resistance, and the arterial compliance. This hemodynamic aspect of hypertension have implication of the diagnosis, risk, and the treatment. Why? If you look to the mechanism of blood pressure, how the blood pressure mechanism is, here it is. Blood pressure is cardiac output, total peripheral resistance, heart rate, stroke volume, arterial pressure, venous pressure. So it is a hemodynamic thing. It is not a number. And it is wrong. Believe me, you have to understand this. It is wrong to consider hypertension as an isolated disease. It is not an isolated disease. Hypertension, the truth is, it is only a marker of a bigger problem. And hypertension is asymptomatic. This is very important. Multi-organ system disease. If I ask somebody what is disease, you have a symptom, you have a treatment, you have a cause. But hypertension have no symptoms, have no cause. There is no cause. Nobody can tell me what is the cause of hypertension. There is no cause. There is no symptoms. So it is not a disease. So hypertension, diabetes, dyslipidemia, obesity, all of these are coexist. So hypertension, I consider it as a disease and risk together. And this is very important. Why? How hypertension can induce atherosclerosis? Hemodynamic factor. This is very important to understand. Hypertension promotes turbulence flow, which is in turn increase the risk of atherosclerosis lesion, mainly in the bifurcation of the vessel. This is very important to understand. And the most important is we are talking about endothelium. Endothelium, yes. The hypertension with the shearing force and the turbulence can affect our endothelium all over our body. You have to know that the length of your vessel inside your body is 120,000 kilometers. 120,000 kilometers inside your body. And it's lined by single cell layer, which is the endothelium. The question will come, is our endothelium, is one endothelium? The answer is no. And I will show it to you. So what will happen once the atherosclerosis and the atherosclerosis process is related to smooth proliferation and migration of the intima, and the blood pressure, the endothelium is the main part of this story, and the blood pressure, the main part destroying this endothelium. And you have to understand, to cut a long story short, endothelium dysfunction and the blood pressure induce organ damage. This is the story, the shearing force. And this is our endothelium. If you look, there is no one single endothelium. The endothelium of the carotid is different from the endothelium of the heart, is different from the endothelium of the brain, different endothelium of the kidney, different from the endothelium in the penis. All of these are different. So we have different endothelium. And this is why hypertension can lead to multivascular disease. You look here, how does high blood pressure harm the body? The brain, because it affects the endothelium of the brain, and the eye affects the endothelium of the eye, and the kidney, because each endothelium, by the shearing force of hypertension, have been affected. This is why it is multi-organ disease. And of course, this is the most important, erectile dysfunction. This is very common. The people with hypertension has erectile dysfunction. So, hypertension, multisystemic, and polygenic disease. You have to understand this. Hypertension and the metabolic syndrome. When we say metabolic syndrome, it is impossible to see someone obese, diabetic without hypertension. Is there any relation? Yes, very big relation. What it is? Cardiovascular deaths increase in hypertensive diabetes than who are not diabetic. So which means that the hypertension is the risk, the joker, the one who will make any disease much worse. So you have to understand this. And insulin resistant. Is there any relation between insulin resistance and hypertension? The answer is yes. There is a very big relation. Another important point, hypertension can cause diabetes. This is something very strange. Yes, in hypertension, muscle switch to type 2 fast switch fiber, which are insulin resistant. So hypertension can cause diabetes. So to understand each problem is diabetes and hypertension, they are going hand in hand. They are together. So Dr. Abdullah was very intelligent when he gave me the talk, what is called, it is a hemodynamic. Yes, I was looking for this, but he gave me the answer without knowing. So the two terms, diabetes and the hypertension, they are associated together. We have to understand this. And this is a very old trial, UKPDS trial. If you talk to any endocrinologist, they said, oh, it is an old trial. Don't look for it. It's an old trial. But look, something very important in this trial. They find in the UKPDS trial, in the first phase of the trial, that if you give a diabetic patient treatment for diabetes and they give the diabetic patient treatment for hypertension, we'll find that the tight blood pressure control was giving you the answer. Of course, after 10 years, when they follow UKPDS trial, after 10 years, they find, yes, when you treat diabetes for longer than 10 years, you get the benefit. But the early phase of the UKPDS trial give you without any doubt that treating hypertension in a diabetic patient give you the answer of protection. So this is very important to understand. So to summarize again, important risk factor for vascular endothelial damage in patients with type 2 diabetes or metabolic syndrome, which is obesity, hypertensive diabetes, is the endothelial dysfunction, which is all related to hypertension. Now, I want you to concentrate in this slide. This is by Dr. Eugene Brunel. In one of the meetings in the American College of Cardiology, I remember 2012 or 2011, I attended one of his lectures, and they asked him, what is the cause of heart failure? And the answer was very clear. The cause of heart failure is high blood pressure. Once you are normotensive, you are protected. Once you start to be elevated blood pressure, you are left ventricular dysfunction, heart failure, and death. So it is very important that put hypertension in any disease, it will make it worse. So hemodynamic component of the blood pressure, this is very important to understand. We have the mean arterial pressure, the cardiac output, the variable resistance. If we look here, then young elastic vessel and old elastic vessel, which means young age and old age. Look to this. I want you to concentrate. Young compliant artery, normal pulse wave velocity around 8 meters per second. This is the response, and this is the stall. So what this will lead to? Peripheral amplification, increased coronary flow. Now go to the old people, and with loss of elasticity, what will happen? This will happen. The velocity will be 12 millimeters per second, and this will give me ventricular vascular mismatch, the reflection wave augmentation, aortic blood pressure in late systole, and this will lead to increased vascular afterload, decreased coronary perfusion, increased subendocardial ischemia, increased endothelial dysfunction. All are recognized with hypertension. It is hemodynamic. Yes, it is hemodynamic. It has been shown that If you are truly hypertensive, you will never be controlled by one medication. You will need more than one medication. And this is why, so the question is, which combination we should consider? We have to know that we have multiple factors in the hypertension, blood pressure component. So this is why we said the objective of antihypertensive treatment is not reducing the blood pressure. It is protecting the vessel. And this is why any antihypertensive medication that can protect your vessel from endothelial dysfunction is what we need. So it is not one size fits all. We have to understand this. You have to know that we have alive, the tall, the short, the obese. There is no one fits all. For example, patient number 1, his renin-angiotensin system is much more than part of the component. Patient number 2, the sympathetic nervous system is more. Patient number 3, total body sodium is more. So it is not like this. And this is why the guideline 2023, the recommendation is first start by dual combination. If not controlled, go to 3 combination. So please don't forget when you are dealing with patients with hypertension about sleep apnea. This we forget all the time about sleep apnea and the relation with hypertension. So this is our office because now 2 billion people in the world, they are hypertensive. Thank you very much.